Hi, I'm Kevin Rosenbloom with Kevin Orthotics, and I'm at the New York State Podiatric meeting. And I wanted to tell you a little bit about our G-brace line. We have our G200 and our G120, which is a traditional gauntlet style brace, and this is a free motion articulating gauntlet style brace. And although we've seen this historically in the literature and in our clinics as being the gold standard for gauntlet braces, I found in the past couple of years that this brace I've actually been refurbishing more for patients, which is a good sign. One, they're actually wearing it a lot more, and two, it is taking care of their symptoms such as posterior tibial tendon dysfunction, ankle arthritis, overpronation, and other deformities. And looking closer at the two of these, what I found is being the biggest advantage of this over this style is there's no vamp, which makes it a lot easier for them to get into the shoe, and having ankle range of motion makes it much more convenient and comfortable for the patient to walk and ambulate without having any impingement along the lateral or the medial aspect of the brace as it attempts to flex in the shoe and they try and pronate through it. Essentially, it's kind of a ski boot style, really restricting and quite uncomfortable. Some patients do need this much control, but I feel that historically I've seen it overprescribed, whereas something that does allow range of motion, such as this, is quite nice. And compliance is up, and I've seen a lot of our clinicians, their numbers are up, they're more confident in prescribing this brace. In order to prescribe this brace, the G200, the G-Brace 200, we do need a cast STS mid-leg or Bermuda sock to the height of the brace that you wish to construct. And I do prefer to have it at 90 degrees, semi-weight bearing. I actually, when you're taking the impression of the foot, have the foot up in the air to put the STS sock on, and then down onto the ground. And I actually do like to pronate the foot about 50 to 90%, depending on the age and how well they're going to tolerate any arch support. And what that does is internally rotate their ankle bone and relieves any pressure that you typically see in these braces. Oh, we need to stretch out the navicular head, the talus head, the medial malleolus, things like that get impinged on the brace when you just have them inverted in a neutral position, and it becomes a big headache and they actually do not wear it when you're trying to correct them so much. What I found with this is if you do pronate them about 90% for someone who's usually over 65, and if you're over 45 to 65, I see about 50% pronation works really, really well. And go to our website, kevinrx.com, and there's more information, and feel free to call our toll-free number to talk to myself or one of the other client service representatives we have. Our 800 number is 877-SOS-FEET. Thanks.